All right, today we're going to crack open one of medicine's greatest detective stories, the neurological exam. You can think of it as a full-blown investigation, where a clinician follows this trail of clues to solve a mystery deep inside the body's most complex network, the nervous system. So where does an investigation like this even begin?
That's the big question, right? When something goes wrong in the brain, or the spinal cord, or the nerves, the body starts sending out signals. The neurological exam is this incredibly systematic process. It's a whole series of tests that lets a clinician read those signals and figure out exactly where the problem is hiding.
You know, every good mystery starts with a call for help. In neurology, that call, it comes from the body itself. These are the warning signs, the very first pieces of evidence that tell a clinician, okay, it's time to put on the detective hat and start looking for clues. So what do these 911 calls from the body actually look like? Well, it could be anything really. Maybe it's feet that have gone numb or a muscle that just feels weak for no reason. It could be balance problems that make just walking across the room a real challenge. It's also something that's done pretty much standard after a big event like a stroke or a head injury, or to help manage ongoing conditions like diabetes. These are the first clues that kick off the whole investigation. So once the case is officially open, the detective starts with the brain's higher functions. You can think of it like checking a computer's operating system. I mean, before you can start running diagnostics on the hardware, you've got to know if the core software is even running, right? The accuracy of the entire rest of the exam really depends on this first step. The very first check is on consciousness and arousal. And this isn't just about being awake or asleep, it's the brain's fundamental readiness for action. Essentially, is the system powered on? Is it listening? This gives the detective the baseline for every other clue they're about to gather. To assess this, clinicians use a pretty clear scale. It starts at alert, which is where you want to be, fully awake and with it. But from there, it can go down to lethargic, where someone's drowsy and can't really focus. Then, obtunded, which is even sleepier and confused. At the really low end, you have stupor, where a person only responds to something strong, like pain. And finally, coma, where they can't be roused at all. This scale gives the detective a really precise first clue about just how serious the problem might be. Now, to make this whole assessment totally objective and universal, especially in an emergency, clinicians rely on a gold standard tool. It's called the Glasgow Coma Scale, or GCS for short. It's just a fast, super reliable way to measure and track a patient's level of consciousness over time. The scale is simple. It runs from 3 to 15. A 15 is a perfect score, means you're fully alert. But a score of 8 or less, that is the critical number. It signals a severe brain injury and usually means a patient needs some serious, life-saving help and fast. So how do they get to that number? It's actually a combination of 3 different tests. First, are detective checks eye-opening? Are their eyes opening on their own, or only when you talk to them, or only in response to pain? Then there's verbal response. Is the person oriented and talking normally, or are they confused, or maybe just making sounds? And finally, motor response. Can they follow a command like squeeze my hand, or do they only move when prompted by pain? You add up the scores, and that total gives you a powerful, standardized clue about how the brain is functioning. You know, even just language itself provides some incredible clues. Take aphasia. With Wernicke's aphasia, a person might speak perfectly fluently, but the words are all jumbled, almost like a word salad, because their ability to understand language is what's damaged. But with Broca's aphasia, they understand you just fine, but they really struggle to get their own words out. It's fascinating, right? 2 very different communication problems, and each one points the detective to a very specific and different spot in the brain. Okay, so once the operating system is assessed, the detective moves on to check the body's wiring. This is all about testing the sensory system, that huge network of nerves that sends information from the body up to the brain. And sensation is really broken down into 2 main types. You've got superficial sensation, which is exactly what it sounds like. It's what you feel on your skin, things like temperature, pain, or a light touch. Then you have deep sensation. This is more like your body's internal GPS. It's knowing where your arm is in space without having to look at it, or being able to feel the buzz of a tuning fork on your ankle. Testing both gives a really complete picture of the body's input channels. And here's where the detective work gets really clever. It's not just if there's sensory loss, but where the loss is. A stocking and glove pattern, where it feels like you're wearing long socks and gloves of numbness, that points to a problem with the nerves in the hands and feet, something called peripheral neuropathy. Loss on just one side of the body, that suggests an issue up in the brain itself. And if the loss follows the exact path of a single nerve coming out of the spine, what's called a dermatome, well, it points right to a problem at that specific spot. The pattern is everything. It's the ultimate clue. So we've checked the operating system and the input wiring. Now our detective has to examine the output, the motor system. This is all about how the brain's commands actually get translated into physical movement. A huge clue here is muscle tone. Now, when tone is too high, it usually comes in two main flavors. There's spasticity, where a limb feels tight, and that resistance gets even stronger the faster you try to move it. This usually points to a problem in the main motor pathways coming down from the brain. But then there's rigidity, which is different. It's this constant lead pipe resistance no matter how fast or slow you move. This suggests an issue in a deeper part of the brain that helps coordinate movement. It's a classic sign you see in conditions like Parkinson's disease. And again, this isn't just a subjective feeling. To be really precise, clinicians use what's called the modified Ashworth scale. It lets them grade that spasticity on a clear scale from 0 to 4, which gives them an objective way to measure the problem and track whether it's getting better or worse over time. And now for one of the most famous, and frankly, one of the absolute coolest clues in all of neurology, the plantar reflex. It is amazing how much this one simple test can reveal. Okay, so here's the deal. In an adult, when you stroke the bottom of the foot, the toes are supposed to curl downwards, or flex. But if the big toe goes up and the other toes fan out, that is called a Babinski sign. And in an adult, that is a major red flag for a problem with the main motor pathways coming from the brain or spinal cord. And here's a fun fact. That same upward response is completely normal in babies up to about a year old. So, the investigation is almost done. The mental, sensory, and motor clues have all been collected. Now it's time for the final act, putting it all together to solve the neurological mystery. And this is where all the evidence just clicks into place. So let's say you have a combination of weakness on one side of the body, that spasticity we talked about, and that positive Babinski sign. All the clues point straight to a problem in the brain's main command pathways. What about that stocking glove sensory loss plus some weak reflexes? Well, that clearly tells you the issue is with the nerves and the limbs themselves. And rigidity combined with a tremor, that points directly to the part of the brain that coordinates movement, something you'd see in Parkinson's. The pattern of evidence reveals the answer every time. Ultimately, what the exam really shows us is just how deeply interconnected this whole system is. It shows that good motor function is pretty much impossible without good sensory information. You just can't separate the inputs from the outputs. So the exam isn't just a checklist. It's a way of appreciating this incredible, complex feedback loop that lets us interact with the world around us. And that's really the power of the neurological exam. It's a structured conversation that allows a detective to listen to the story the nervous system is telling. It's a brilliant process that reminds us of the incredible complexity humming away inside all of us, constantly writing and rewriting its own story. So the only question left is, what story is your nervous system trying to tell you right now?